North Carolina getting into another COVID-19 wave following the winter holidays. And tomorrow afternoon, we are expecting a state update showing just how prevalent the virus is. But as we do see more people fall ill, we wanted to touch on the three big things that you need to know right now about this current COVID landscape. And the first is this latest strain of COVID. It is apparently the most transmissible, but doctors say also potentially the least severe. So doctors say it's something of a natural selection that's underway here that causes this trend where the most infectious versions of a virus will spread the most, and the less severe versions have the best opportunity to reach the most people, since the carrier might feel well enough to be up and moving about. That brings us to number two. We're not necessarily saying that people aren't getting seriously ill or dying from this strain. In fact, doctors say they are seeing those who are older, those who aren't boosted with the updated shot, those with underlying conditions. They are still being hospitalized, and they're being hospitalized the most.
CDC data shows that the rate of COVID-related hospitalizations in unvaccinated adults 65 years of age and older was 13.5 times higher than those who received a bivalent booster. And those who've been vaccinated but had not yet received the booster were 2.5 times more likely to be hospitalized.
Finally, let's talk procedures. What do you do if you have symptoms? Well, doctors urge that folks with mild COVID symptoms to test. They would say use an at-home kit. Go to the doctor, go to the pharmacy, go to urgent care. They say don't go to the emergency room with mild symptoms, potentially spreading the virus to others, waiting in the waiting room there, backing up the service there. Also keep in mind that a positive test still means isolation nowadays. So the current guidance from the CDC is 5 days for a mild case, and also masking around others for up to 10 days or until you get 2 negative test results in a row. And those would have to be taken at least 48 hours apart.